What's going on, everyone? Welcome back to another episode of the Green Bay Health Project podcast. I am Trevor, and today we're joined again by Dr. Kim of Innate Healing and Performance. And we're going to talk about something that has really made the whole world an expert in weight loss. And it's going to be good old GLP-1s. You know, there's a lot of info going on around there or out about them right now. And I thought we should bring in an expert on the topic to really talk about maybe who it's best for, who it's not, what you should have in order before maybe approaching the topic with your provider, and anything else that Kim wants to talk about. So Kim, first of all, if you want to learn more about Kim, we've had her on the podcast in the past. I believe it's episode 79 and 83. It's a while back now. But she talks more about herself, and then we definitely have one out there on gut health. So Kim, I appreciate your time. I know you got a lot going on. Thanks for talking about this.
Yeah, thank you so much, Trevor, for having me on. Honestly, this topic in general has definitely been something that's come at me a lot with my patients and clients, for sure. So this doing this podcast is something that definitely kind of nudged me in the butt to get a little bit more guided information out there. It's certainly a topic that I discuss with clients, like when I see them one on one. However, I haven't been great about like social media or things like that, getting some of this information out there. And I think originally in the beginning it was kind of like a wait and see, kind of sit back in the weeds a little bit. There was so much information like going out about GLP agents everywhere, on the internet and anywhere, Google, all those kinds of things. And there's still not like a lot of known specifics about GLP agents. And so now with a little bit of time under our belt, and certainly not like the most adequate amount of time, we want to have longer studies and more data, but we do have some of these this early data happening and results for people. And, at the end of the day, people would not be raving and kind of talking about this subject in general if they didn't work. However, our discussion today is going to be more centered around one, just education on GLP agents, and then two, kind of like an optimal or a more structured potential use of them, who they may be good for and who they potentially are not, like a first line recommendation, certainly for people. So I look forward to just diving into that topic today. And thank you so much for having me on. And just for the listeners out there too, I really feel very adequate in order to talk about this topic because I am a licensed pharmacist. So it's sort of our bread and butter, just understanding like pharmaceutical agents, the pharmacology of how they work in the body, and just my clients in general get this added bonus of the functional medicine connection and more of like a health coaching guidance through use of any functional prescriptions as well.
100%, Kim. Let's kick it off. I think the first thing we need to answer is like, obviously people think of GLP-1 and they automatically go to weight loss. Like, I think, at least in my mind and what I'm hearing, that's what our questions are around. But first and foremost, what is it? Can you just answer that question?
Yeah. So at the core, GLP agents are something we call peptides. So if you're not aware of what a peptide is, it's basically this targeted short chain amino acid sequence that kind of acts like a little chemical messenger in your body. And it sends signals to help regulate and repair key systems in the body. So again, kind of think of it like these little I tell people like tiny biological like text messages telling your cells exactly what to do. So it helps the body remember how to function properly. And some of those functions can be supporting energy, metabolism, recovery, inflammation throughout the body, sleep, hormone balance, all those things. And it kind of is just helping your body, helping nudge your body back to optimal function at the end of the day. GLP agents are technically synthetic peptides. So again, they're man-made versions of the natural hormone signals your body already produces. Specifically, GLP agents are medications that primarily work on gut hormones. So people may have heard the terms like leptin or ghrelin. They help regulate hunger and blood sugar signals in the body. So these are signals that tell the brain when you're full, how to regulate digestion, so slowing digestion and helping improve insulin response. Now, they don't directly replace leptin or ghrelin, but they do influence them indirectly, I tell people. So again, ghrelin is the hunger hormone. It rises when your stomach is empty and it tells your brain to eat. And leptin is the satiety hormone. So it's released from your fat cells to signal that you've had enough energy consumption. So in many people with like weight or metabolic issues, or we're even going to get into like autoimmune conditions, the brain actually stops responding properly to leptin. And we often call that leptin resistance. So these agents help kind of quiet this ghrelin driven hunger signals and improve the brain's response to some of these satiety cues. And that also helps leptin do its job a little bit better. So that's like a little overview of it. But again, because they are peptides, they work with our normal human physiology. Again, they're lab made versions of these hormones, so they're broken down naturally by our body if utilized. They don't really store in tissues like some traditional drugs. And then right now they were ideally given by injections because a lot of peptides can get digested quickly and lose a lot of bioavailability if swallowed. However, I know that they just came out with actually an oral GLP agent. So interesting to see how that will start to work for people. Again, this GLP in general also stands for glucagon like peptide. And this is the natural hormone that your gut releases when you eat. So in summary, I kind of just help you, but it helps tell your brain when you're full, helps slow stomach emptying to help you feel satiated a little longer. It can reduce blood sugar spikes, lower insulin overproduction, or we talk so much about just kind of quieting cravings or like food noise for some people.
No, that makes a lot of sense. And you can tell, I mean, just from your explanation of it, you can see why it's appealing to a lot of people. So, like, I guess leading into the next thing, who's the best fit for this? Like, if we just jump right in, is there, who's the right person? Maybe clinically, what do they present with or what are they seeing? And then obviously, you and I have talked a lot about like the fundamentals as well. So, like, where does this fit in? I might be jumping the gun, but let's go there.
Yeah, well, just kind of like a little blanket statement kind of to address your question in general. It's very individualized. So it can particular individuals are going to benefit sometimes from particular GLP agents too, because we know that there are different ones. So there's like what you call a single agonist, there's dual agonist GLP agents like tirzepatide. So semaglutide is the single agonist. Tirzepatide is a dual, and now there is also like retatrutide, which is like a triple agonist. And I'll first kind of also just provide a little bit of education on like how each of those agents work, and then that also can dictate if somebody's using what agent potentially may be beneficial for them. And then again, we'll circle back into like who this isn't for, and then also having a really good discussion about like what you should be doing, which is 100% like fundamentals and foundations absolutely have to be in place before you even consider something like this. And we know very well, I think, in the wellness space that's not always happening, especially when individuals are working with like a conventional medical provider who it's just kind of like, oh, this new therapy comes out and it's like first line
Right.
therapy. And we are so much, married to this teaching and educating our clients and patients about nutrition and fitness and just like good wellness habits in general. And we all know that not a lot of those things are always going on first. So you really, as a practitioner and a provider, you really want to make sure you have a strong relationship with your patient and or client, and making sure that those foundations are in place first and that they have been doing, XYZ. And again, we'll get into a discussion where that's where I do have a very special place in my heart as a practitioner, understanding and like knowing when the correct times to use potential like prescription medications are. I feel like I would be such a hypocrite or something if I instantly just said, okay, I'm not going to work with you because you're utilizing a prescription medication. That's like insane. We know that certain medications are necessary and they help people in a wide variety of ways. There's no denying that. So I'll break down, first of all, the difference between the agents. Glutide in general, it's a GLP-1, so it mimics our gut hormone GLP-1 that's produced. It's more commonly known for like strong appetite suppression. It can slow digestion, improve blood sugar control a little bit. It's the most well-studied and definitely the most widely available GLP agent, and oftentimes tends to be, I guess, but I would say a little bit when they first came out, for sure was a first line option. But now I feel like I've seen more of this dual agonist or a triple agonist recommended from practitioners. So the dual agonist, like tirzepatide would be the brand name. it's stronger insulin sensitivity effects. And then there has also been seen in clinical trials a greater weight loss or fat loss than just a single GLP agonist alone. And then the metabolic profile improvements have been stronger and more robust for this dual agonist. And then the triple agonist, well, I'm going to circle back just for a second too, because I'll describe them all. GLP-1 is made by like cells in our small intestine, especially like our ileum and colon area in response to food. There's a little bit produced in the pancreas and the brain as well. The second agonist is called the GIP or glucose dependent insulin tropic polypeptide. That's a mouthful.
I was gonna say, these are a lot of like
I know, right?
kudos to you for saying this stuff accurately.
Yeah, like GLP-1, they're called GIP and glucagon agonists. But those, the GIP agonist is made in K cells in the upper small intestine, so like small duodenum and jejunum area. And that's released after eating and circulates in the blood to act on pancreas, fat, and other tissues throughout the body. And then the most newest agonist that has been added to the peptide sequence is a glucagon agonist, and that's primarily produced by alpha cells in our pancreas, a little bit in the small intestine and brain. But again, glucagon is released from the blood when blood sugar is low, so it helps produce and stimulate more glucose and production specifically through the liver. So again, with that triple agonist, there has been more increased energy expenditure and fat mobilization for people. So, of all the three agents, early clinical trials have shown the highest average fat loss potential for people. And again, this is all there are clinical studies and data out there demonstrating weight loss effects. And I just want people to be clear, like the clinical clinical trials and studies, it's simply measuring weight loss for people. Okay, they're not talking about all the other things that we want to get into, such as muscle mass retention, talking about motility in the gut, things like that we want to be like making sure that we care about even before you would consider using an agent. So that's definitely the science background. So I'm glad we got through that piece for people. But
Well, you crushed it.
yeah, so more often than not, I think like the average like patient or client that these are being utilized for is of course diagnosis of type 2 diabetes. They have been used more for weight loss and then more increasingly specific autoimmune conditions as well. And that is where we kind of tap into more use of like microdosing of a GLP agent that has been more helpful for people. So
What's autoimmune have they looked at?
things like Hashimoto's, I have clinical studies and papers demonstrating the benefits of things like endometriosis. So just some of these stronger, these are metabolic. They're linked to like metabolic PCOS, things like that, where there's strong inflammation throughout the body.
Makes
Yep.
sense. That's interesting. I didn't know that.
Yeah. So I was like, the the simple way to kind of explain them is like semaglutide in general kind of helps people eat a little bit less, I guess. Tirzepatide helps you eat less and improve your body using insulin, and then retatrutide would be helping eat less, insulin use, and then also increases calorie burning and fat oxidation essentially for people. It's basically they are similar families of the agonists, but they as you move up to the agents, it increases different metabolic points. But yeah, I mean, semaglutide can be ideal for someone who's maybe new to GLP therapy or needs one. Lower side effect profiles generally. We'll get into that too. Tirzepatide more appropriately for blood sugar, strong blood sugar dysregulation. Retatrutide if they're a strong metabolic dysfunction, potential genetic abnormalities in cholesterol. It's a higher therapeutic intensity too, but so it's not always appropriate for everyone. So
Yeah.
yeah, a lot of people. So let's dive in. Let's get into like a clinical conversation as well. I
Yep.
think that so again, we have all this scientific data, research, literature demonstrating the effects of GLP agents on weight loss. So it's not generally at this point it's not a question of if they work. We've seen them work for sure, and that's why they're so popular, I would say. However, there's a large gap in between like what I professionally, again, this is my professional opinion, from what I'm seeing of like proper and supportive use of a GLP-1 agent, because I know from experience, you generally don't have this like 60-minute visit where you're sitting with your doctor and you're talking to them about nutrition, you're talking to them about your protein intake, you're talking to them about your fitness goals, right? They don't really like get your fitness and exercise routine. They don't really get into that with you. I think anybody could walk into a doctor's office and just say, "Oh yeah, I'm eating healthy, I'm exercising, and I'm not losing weight, so I want a GLP agent."
100%. Absolutely. There's no
Because
doubt
how are
about
they
that.
gonna, how are they gonna investigate that? Whereas I'm just using my own particular case in general. Like I have most of my client and patients like health history and background like right in front of me. I have notes on like what they're eating. I have notes on like what kind of fitness and exercise they're partaking in on a regular basis. But also, I usually have a large background in terms of what their hormones look like, their thyroid regulation, cortisol regulation, all of these things, which are super important and just foundations and fundamentals first before you should even consider a GLP agent. Because the biggest thing that we've seen for sure is the loss of muscle preservation with the use of a GLP agent, and that is quite common if the route of utilizing a GLP is basically your first line therapy. If you're saying, I'm just instantly gonna take this shot and it's a quick fix in that clinical scenario, right? There needs to be a large discussion around nutrition and fitness before that even goes into place. And again, I am also more inclined to making sure that all the other systems in the body are balanced first. We're looking at gut health, liver health, sex steroid hormones, cortisol regulation, sleep, all those things. And if I truly feel a client or patient is like doing that pretty eloquently, and I know they've been doing all the things, so to speak, then we can bring a GLP agent on the table for discussion. And our conversations are always centered around safe use of these types of agents. So I'm usually kind of walking them through any type of like starting doses, how to titrate, and then like maybe potential maintenance dose. And what happens when you want to stop a GLP agent? Because that's always a common question too. So we should totally answer that too. Because here is, I'll just be blunt about it. Like you're going to be way more prone to rebound weight gain after using an agent if you literally do not have those foundations in place. If you were never hitting protein goals, if you were not resistance training, if you did not have your other organ systems balanced to begin with, if you're not adequately intaking hydration and electrolytes properly, fiber properly, prioritizing sleep and stress management, like all those things, right? Like you're just instantly going to gain the weight back as soon as you stop. It reminds me a little bit of the time when people were always doing like all these like shake cleanses. Like
I was just
I'm
thinking
not
that
going to
too.
name any particular companies, but
You can
it's
name them, like, why not? Throw shade.
because people would just like they would do meal replacement shakes for meals, and then that was working for them for like 30 days, maybe 60 days. And like I remember I was waitressing with like a friend who was doing that, like this was like, I don't know, 10 years ago. And she had this kind of like, yeah, drastic weight loss, kind of like 20 pounds, very noticeable, all things. And, you start chatting with her and ask her what she was doing. And she talked about what she was doing with like meal replacement shakes. And then it was like as soon as she stopped doing that, like there was just rebound weight gain, right back. And it's gonna be that same. So GLP agents, they don't have to be like a lifelong thing. They can definitely certainly be a tool that can be utilized for people, but more often than not right now, like ask yourself. You really need to ask yourself, are you doing the foundations first? Um, and that's the big key piece to this. You can't really like outsmart your body in terms of that. And again, it will come back to kind of bite you in the butt. If you are using an agent and then all of a sudden you stop, or, God forbid, we don't have access to these anymore, because that always happens with things. There's always medication shortages, drug shortages. I'm super well aware of that, of working in kind of clinical pharmacy for many, many years. So yeah, that's my that's my kind of introduction piece to it.
Well, I think that's a huge, like, I remember in a past conversation between you and I and my own things. I mean, Kim's got me on this sick peptide stack right now, guys. Sleep is incredible. Like when you get good sleep, bro, I've been waking up at 5 and I'm like crushing workouts and it's incredible. But I think to your quote, one thing that I'll never forget you told me is like, I'm obviously a high stressed individual. I've got, I'm working through it, but you can't out supplement stress. And so like, I think that just like lives rent free in my mind. Like one thing that you told me, and I'm like, I've got to figure this out because I mean, admittedly, I have put a lot of stock in the supplements and not necessarily looking at other factors. And so I think that's a huge point. And I just wanted to hit that home. Like, I appreciate that statement so much. And so I think it's a huge thing to know. Like, you've got to dial in the fundamentals before you try some of this stuff because it's not going to fix underlying things. And so, like, I appreciate you, Kim. And that just know that that statement lives rent free. And I say it all the time.
I talk about this so much to my clients too. Is this it's just that even because I service, I mean, I help both males and females, but definitely a larger amount of female clients. And one thing I tell them and just kind of remind them is that like we're cortisol regulation and adrenal health and like stress management and reduction of stress reduction techniques and methods are so important. At this point, I feel like it's just like it should be number one too, like sleep and stress reduction, number one. Um, the more stressed you are, the more stressed you are, the more likely your cortisol is dysregulated and the quicker you're going to store fat, especially around your hips for women. That's also another, like, scientific piece that goes into, like, perimenopause and menopause transition. I really have a special place in my heart, I say, for my, like, perimenopause and menopause clients as well. And, of course, like, other clients who are struggling with, like, autoimmune conditions, considering, like, my background with endometriosis and, like, how, I've been able to kind of help people through these, like, autoimmune processes. I want people to understand too that I wanna help you feel seen and heard. If you are truly genuinely doing these, like, kind of rule of thumb principles, and I wanna break those down too. But if you truly are doing those, like, and you're still noticing, like, just kind of consistent weight gain maybe, um, during perimenopause and menopause specifically, there is the transition for estrogen in the body and basically like our declining estrogen shifts, they also help regulate hunger, insulin, and fat storage for women. So this is why during this time period it's a common thing for people to say, I feel like I was going through life and I eat healthy, I exercise. I literally haven't done a single thing different. And all of a sudden, over the last like year, when they're in this time frame, they're noticing like, 10, 15, 20 pound weight gain, which feels like overnight to them. During this time, many women kind of develop increased leptin, like I talked about that leptin resistance, stronger kind of ghrelin driven hunger signals. So people are just like, they say things like, I just want to like quiet, I want to quiet the food noise. They also experience reduced insulin sensitivity. I have lots of blood work panels from, you know, seemingly like healthy individuals on the outside. Like they really are doing great things. We've had conversations about like whole foods and trying to eat anti-inflammatory diet, making sure that they have consistent timing of their meals with proteins, fats, and carbs. And trust me, I'm always trying to help women to understand and get
Of
into
course.
regular eating habits because so many people just like skip meals and then they're just like always on the go. And then they're like, that's like I said, that's a principle. We need to work through all that stuff first. During that, I've seen like high fasting insulin levels. I've seen like higher glucose readings. I've seen LDL markers go up a little bit for them and they're having more reduced insulin sensitivity at this time because of this shift in their body during perimenopause and menopause. And that often leads to increased cravings, easier fat gain, and especially around the midsection for women. they often will say things like, I feel like I have this little pooch or like that I'm carrying around. And no matter what I do with nutrition and exercise, I can't seem to kind of get rid of it. They just have a little bit more difficulty losing weight, whereas previous things that they've done in the past, like when they were younger, were always working, kind of like textbook and clockwork. And some people fall off the wagon, they get back on and do those things, despite kind of those consistent healthy habits. Even in this space, like a woman who was doing all those really good things, they would be a good candidate for like starting with a microdose of a GLP agent to help them restore those kind of strong satiety signaling messengers throughout the body, helping stabilize potential like blood sugar imbalances, insulin response, just kind of managing their appetite a little bit better too, and support fat loss a little bit through the hormonal transitional stage. And again, I nobody comes into my practice kind of actually seeing or hearing about that until we've even done the foundations or fundamentals. It's sort of like it might be that last component where they're like, "Dang, Kim, like, I feel, like, so good with, like, hormone balancing, maybe bioidentical hormone support, maybe helping get their thyroid functioning better and just more optimized, and helping them with cortisol regulation, maybe helping them with sleep too, helping them balance nutritional meals, improve their gut health." That's a big one. Like, a lot of people don't realize the large effects that like gut health has on whole body health. So like I'm always trying to get people to understand too, well, before we even jump to this kind of agent, we need to like fix your gut health too. Cause like you have underlying things that you don't even realize. Like, for example, if people have like low levels of akkermansia in their gut, they're going to be more prone to metabolic imbalances or weight loss resistance. That's one example. People don't even know that. Now, I'm not saying you can go out and buy an akkermansia supplement on full script and it's going to make you lose like 10 to 20 pounds.
Didn't say
Don't get
much.
me wrong. It's going to help that signaling and that response and everything. And there's even like the like GLP like fiber supplements and stuff, which I think are, would be
Interesting.
even better like starting places even for some people. But yeah, I mean, if you go look at a GLP like probiotic, the back of it says like Akkermansia. That's the actual active ingredient. So I tell people, but they don't realize like, I mean, that's one little piece from a gut test, but there's so much other things. Like, are you absorbing minerals and nutrients? Like if you're working with a lot of people find benefits from working with like a macros coach or something where they're really getting a support with like a nutritional breakdown and helping them understand like portion sizes, helping them understand just like quantity and consumption of what they're eating per day. Then they are, and if they're not benefiting from that fully too, it could be an absorption issue. I tell people like maybe it's a mineral micronutrient absorption issue because there's all lots of different things that can be imbalanced with gut health. So kind of going off on a tangent there, but again, these are just some of the things that we want to make sure that we have in place, and that's always a place where I'm coming from, even if they don't see that link first. So let me do a brief like run through of like the rules of thumb that we should be doing to help like with the muscle preservation and just like overall health. Okay, microdose. So, yeah, microdose is basically like staying at a super low dose pretty much for as long as you need to. If you're noticing improvements with just like inflammation, puffiness, kind of like cortisol regulation, because sometimes it's just that. Like again, I've heard these sayings from because it helps kind of augment what you're doing with your nutrition and exercise, essentially. So if people feel like they're just banging their head against the wall and they're not seeing any change, and maybe they don't have any like diagnosis or any like like that they're aware of. Again, in functional medicine, we're often running like way more in depth like lab panels than what they're used to. Like I have so many clients say, well, here's my labs. My doctor ran all my labs. And it's like, a like a basic metabolic panel and like a CBC and like a TSH. I'm like, my gosh, there's like way more labs out there that are going to help us identify like any root causes that you're feeling, right? This is like the all my labs are normal kind of thing. Well, that's like I think it drives me bonkers when people are like,
I
well,
bet.
I get my
Can't
labs
imagine.
done all the time, and I'm like,
Yeah.
no, you get a once a year like little physical, and they do like a micro lab assessment for you. Anyways, so microdosing is like that. So even like the average, a starting dose for like a GLP agent might be like point 2 5 milligrams or something. And so you could stay at a micro dose like that once a week injection. And that may help some people kind of actually tip the scale a little bit in terms of like starting to have their fitness and nutrition potentially move the needle a little bit. Now, yeah, I think what I see often in like conventional medicine is just like basically a fast titration of the medication. And people basically have this, they can have like a 20 to 30 pound weight loss. And I've seen it. I mean, I've seen people like, even my husband was like, he knows a guy like at his work who is just kind of like, oh yeah, like as soon as he started on those agents, it was like night and day. He was like,
Yeah.
dropped like 30 pounds just like that. However, he was like, yeah, now he's like skin and bones.
Mhm.
That's an, you
Drastic.
don't want to be like,
Right.
what's the term, like skinny fat or something, like
Yeah.
this,
Yeah. Yeah.
we know that this person like definitely was not focused on like muscle preservation, resistance training, like doing good things that you should be doing outside of the doctor's office to help maintain longevity with your health. And that's the biggest discrepancy that I've seen right now, because that conversation is so much deeper than just a 20-minute office visit with your doctor.
Sure. Cool. Thanks for answering that. So you want to talk about the more muscular based stuff, right?
Yes. So here's some of our rule of thumbs to kind of preserve muscle integrity and health as you go. So again, GLP as a tool, not a shortcut for people. Number one, protein is non-negotiable. Okay. We low appetite and big calorie drops equal muscle loss risk immediately for people. So protein has to be intentional. Protein has to be the star. And for me, even if like somebody was saying beforehand, well, I know I should increase protein and I just get like a really full fast and stuff like that. Oh my gosh, you would be like a terrible candidate probably for a GLP agent, because we first need to fix and upregulate your digestion first, which can totally be done. I'm looking at things like, okay, do you have compromise in your gut microbiome that's not allowing you to produce enough stomach acid, or do you have poor like digestive enzyme release from your pancreas? Like we look at things that are compromising that. Now I will say that it's a natural so similar to like as we age and we naturally lose hormones and we naturally lose stomach acid production. So this is often why even like elders in a nursing home will be like, they kind of eat like birds. They don't eat much because they feel like they're full all the time. It's because they've lost probably so much natural stomach acid production over time. But, anyways, we can help upregulate those things a little bit better so that you can tolerate higher amounts of protein intake per meal too. So that's a thing that we can improve if that's an issue. Okay. We would first improve those things first. And then, of course, assessing like carbohydrate and like fat intake as well. And then resistance training is the insurance policy. So 2 to 4 strength sessions per week, making sure that they're intentional, guided. Maybe you're working with a professional on this. Like literally I just tell people like, don't just go to the gym and like throw around some weights or lift some weights. Like if you have no structure, no plan, no like progressive load and things like that, like this is not, it's not going to help you in any way. You have to, focus on particular movements. Like, I've hired people that to help me with that, even for my own like triathlon and training, things like that. And it was wowie. It was like the difference between working with someone who's an expert in that field and even yourself, you guys with PT, like you got to get the body. Like
Mhm.
that's
100%.
a
Yeah.
that's a good point, right? Don't be starting this type of agent if you're literally like sedentary.
Correct.
Or if
Correct.
you
I'm
have, like, an
glad you said
injury and
that.
you're like, "Oh my gosh, I'm gaining weight because I have, like, an injury." Well, yeah, you're gaining weight because you're literally not moving your body.
100%. And I think that's like, I'm glad you brought that up because I was going to make that point, but you hit it on the head. And I think with the weight training too, like you said it, the progressive overload, make it like targeted, make a goal. Don't just go there and just pick random things. That's not going to do anybody any good.
Yeah, I mean, if you aren't strength training, you're just basically likely to lose all that lean muscle mass during rapid weight loss, essentially. And the other thing is for people like don't let calories fall off the cliff. We say don't just be like, okay, now I'm using this, so I'm just gonna eat less. No, that basically is just also training your body and your stomach to like be in more of a starvation mode versus a supportive mode. And that's where I don't really like seeing like high end dosing for GLP agents. It's just like, okay, if you're not experiencing weight loss, then we just keep on pushing the dose every 4 weeks until boom, it hits. And now all of a sudden you lose, 20, 30 pounds. No, that's like just really good practice. When more of our caloric intake slows, you're also going to see things like fatigue throughout the body, maybe like hair loss. You're going to see plateaus in your benefits of like fitness, certainly muscle loss. This can also be like putting you at risk for things like gallbladder issues, like gastroparesis. We'll definitely talk about like side effects and things like to be monitoring for. But I think a practical coaching like advice would be just like making sure that you have curated kind of protein centered meals and that your caloric intake is also being addressed too. There's a lot of like potential side effects for like dehydration, like loss of electrolytes, and that with GLP side effects. So you need to be like intaking appropriate amounts of hydration and electrolytes. We talk about that like all the time on like all podcasts, I swear, because people just like drink plain water all throughout the day. And it's like, oh my gosh, you're just like diluting your cells and now you're super tired.
Do you have an electrolyte?
Oh, yeah, I have a list of ones that I give for clients which are ones that I think are good, but you can also make your own. There's ones out there. I just tell people like just be mindful and like reading the ingredients. Some of the I think good ones are like instant hydration. I think Redmond's Relight I think is a good one. Uh, that's like a definitely a more reasonable one. Just Ingredients is another good
I
company.
gotta agree.
There's like Jigsaw Health, which has like adrenal and electrolytes. Like Thorne has electrolyte packets on full script. I just like tell people you don't even have to use like a full packet. Just listen to your body. You can like do half a packet or something. If you're sweating more, you're going to need more electrolyte replenishment. But even on a basic day, people are losing electrolytes just from drinking coffee and like I don't know, just running around, stress levels, all those types of things, especially if you have loose stools, then you're definitely losing all your electrolytes. But those are all things to like make sure you just kind of keep up with if you were to use one. Fiber always introduced kind of strategically as well if you don't have a high fiber intake to begin with, because then it tends to cause constipation for people. So we want to start low and go slow and build up that. But that's again, these are just like principles first, even too, because you can control like hunger signals and natural things like that by actually having proper intake of protein and fiber. And then, of course, prioritizing sleep and stress regulation, because those are metabolic signal amplifiers. You're probably more prone, especially women. I will say you're going to be again be more prone to like that slow, gradual weight gain around the hips if you have really poor sleep. If you are struggling with like insulin resistance because you're not eating meals properly, and then you refuse to take a step back from this go, go, go lifestyle because you have to do everything and be everything to everyone and you're not setting boundaries. And yeah, obviously that's a huge issue with a lot of people, I feel like in modern days now.
For sure. Are there other side effects that you'll typically see?
Yeah, so I usually like tell people side effects that you would want to monitor for. Again, they tend to be a little bit more on the extreme version. Like, and this is, I think, if you're getting way too much dose too fast. Nausea or vomiting, it can be diarrhea, constipation, again, from slow gastric emptying. This is like 100% like the pharmaceutical like commercial on TV where all the people are like smiling and they're
And
like
then they
reading
list
all
like
these
the
side
next 5
effects.
minutes of all the things that are gonna go south.
It can be more GI intensity, potential higher resting heart rate for some people, too profound of weight loss too fast, because that equals like nutrient depletion for people if they don't really like realize that. And then again, there are certain like contraindications too. If people have had like history of thyroid cancer, if you have any issues with like gastric emptying, like if you originally came into it with like some of those issues, like these are obviously like more sometimes like diagnostic conditions that people might come in for sure.
Yeah, and I think, it sounds like I mean, it just goes to show the importance of having the other stuff dialed in prior to starting something like this, if able. So what would a responsible, I guess is a good word, long term, like, or not even long term, but what would a responsible plan look like from a maintenance stand or from starting, maintenance, tapering, stopping? Like, what does that look like? And then how would you And then you brought up the rebound or the regain of the weight. Like, how can people maybe prevent that if they were to stop? Like, what does that all look like? So, like a plan.
Yep. Yep. Very good. Well, to answer that one real quickly is just that you will be less likely to experience a rebound weight gain if you are using one of these agents. If you already have the foundations in place of good gut health, liver health, hormone balance, sleep, nutrition, exercise, for sure, 100%. Stress management, all those things. Okay. Those, I don't care if it sounds like an exhaustive or a laundry list of things. Like health is work. Okay. Like for us to be healthy, it's work. And the sooner you accept that, just the easier things are going to get in life for you. We may groan, we may moan, but if you're doing these things on a consistent basis, we don't have to be perfect. Okay. Doing it like 80% of the time, 85% of the time is going to help you feel well overall. Now, that picture may look differently for someone who's like really in the weeds. If they have a very strong like autoimmune condition going on, right? We're going to be probably having to be more restrictive, more bringing the body back into balance first. But I'm saying like these principles and foundations like will generally work well for people. But if you're just someone who's like, you know, deep down that you're not doing these things that we just talked about, and you're just all of a sudden gonna kind of skirt around and go to your doctor's office and maybe say anything that they want to hear because you want to get it prescribed to you or something, things are not going to end well for you, and you're going to be more prone to weight gain, or you're going to get in this cycle where like, oh my gosh, if I stop, I have weight gain, or I just have to keep on using this forever for the rest of my life kind of thing, which sometimes feels defeating for people because they're not like really realizing that commitment in the beginning. But if someone is using one and they want to stop, again, they're going to be more basically they're going to have a stronger propensity to actually have these the effects that they are potentially using it for stick, like actually work for them and stick longer, and then potentially not have to use any agent like that for a while. That's going to be more applicable for them if they have all these foundations in place first.
What else did you want people to know about this stuff, about the GLPs?
Sometimes I just want people to make sure that you're also just giving your body grace, because sometimes like it's I think just in practice in general, a lot of things can get demonized. I feel like we've had such a good conversation in a medical conversation about like how these agents work, like who they would be appropriate for, because we've really harped on that. Like we really did. And you got to ask yourself after listening to this episode if you're really doing those things. I just can't stress that enough over and over again. But they are not like replacing some people, like they really get down on themselves because they feel like it's like a willpower thing, especially like my perimenopause or like menopause clients. These agents are just used to help restore a little bit of the biological signals that make healthy choices maybe a little bit easier to sustain for you too. It's the focus is potential fat loss while keeping muscle always. Protein and strength training are non negotiable pillars that everyone needs to be practicing if they're using any type of GLP agent. And again, this is such an individualized approach. So, yes, that was your question. You wanted to know, like, what's a proper, like, dosing schedule, titration, things like that.
Sure.
I can't fully answer that question, but I'll give you like an overview because it is super individualized for each person. I would never, if I have an autoimmune condition and that's why I'm using a potential like GLP agent, because there's studies that something that people don't realize. I'm going to use an example. Clients with like SIRS or like chronic inflammatory response syndrome, or like MCAS, like mast cell activation syndrome, their body is generally in this like hyper reactive, overregulated and overstimulated like nervous system um like place, and then also they're just like really releasing histamine like all the time. So there are some of the like POTS type patients too. Like there's some of the most like difficult conditions. Like I have a couple clients that are like that, and it's a battle for them to get out of bed every day because they have such irregularities in their blood pressure, their heart rate, their energy levels. They're experiencing like allergy reactions to like even just food, like even just eating for them is a struggle because of potential like strong histamine release. So that's where like microdosing of a GLP agent for that particular population is such a beneficial tool. Like I can't discredit that because I've seen some of the positive effects of that, even for people, even for women, where it's like they've done it, they have enough, if I'm using like bioidentical hormone replacement and they have enough estrogen, like it's clearly on their labs that they're making really good estrogen. However, I know there's different like toxin load things on the body. There's probably more histamine release, and they're maybe still having some breakthrough hot flashes that are ultimately it disrupts your day. Like it disrupts your quality of life. Sorry, Trevor, but you're never going to experience this. But for a woman who's having like 10 to 12 hot flashes a day, like that's just it. I fully understand how it can prevent them from actually just existing. So anyways, they are like potential good candidates for like microdosing and things like that. And I've had such good, like, I think so much of my clients too, like they are sometimes I'm the one bringing up the potential therapeutic or the therapeutic potential of these agents for them because they never even thought how this could help their chronic health condition. But so most of them are super like understanding of going low and slow. But yes, uh, I don't tend to use like I try to reach like microdosing, maybe saying that at that for people. And then you may double a dose potentially every 4 weeks, working your way up into like more therapeutic doses for GLP agents, yes, are around like 4 to 5 milligrams. And again, if you remember from what we said earlier, we start at like 0.25 milligram or like zero point 0.5. So like super, super low. Or not just like giving you this high dose. And yeah, most people would experience those pharmaceutical laundry list of symptoms if you did that right away to them. So sometimes I may get up to that potential therapeutic dose and sometimes not. I will say that I've mostly been like helping people with this probably since like August or late fall of this past year. So I don't have like too much long term, but most of them they are not on like very high doses of any. At least my clients are not on very like high doses of GLP agents. And I don't really want to get them to be there. And I will say that um, again, I am more in a space of just understanding that it's more of a how you feel in your body type of thing. Like if you feel like you're puffy, inflamed, and I know you have things going on and we just like underlying chronic health conditions, like I want to help bring that back into balance. And I don't want to throw every medication at you in the kitchen sink. And that's a good point. Like you said earlier, just like kind of like over supplement load. I feel like I definitely love my little like maintenance stack of supplements, and I don't think I'll ever stop personally taking them. And when people ask me about supplements, I just say if maintenance wise, you can use stuff that helps you feel good if you feel like that's helping you. Because ultimately, at the end of the day, like professional grade supplements, you should notice a difference if you're taking them. And if you're not, you're probably not absorbing them well. There's probably some issues with the gut health. And then even before all that, like I don't even like people like, okay, I need iron, I need magnesium, I need this, I need that, for every deficiency that you have on a blood work. But I think my first and foremost thing would just be going back to fixing the gut because then we can absorb more whole foods and nutrients and minerals. My place for most supplements is just, based on the large gap in like our nutrition in general, like our food sources that we have. I wish that all of us had access to like organic and very high nutrient dense and like grass fed meats and all those things. And sometimes I have to be in a place of understanding that, knowing that like not everybody has access to that. So I really want to help them with like helping them absorb things the best that they can. So that's kind of like a little statement about that. But there's definitely, I mean, supplements are definitely, if you're getting the right ones, they can be a powerful tool for sure. And especially peptides too.
I can attest to that. So basically, to round it out, like if you're considering taking GLPs, like there's a right way, there's a wrong way, there's a right time, there's a maybe not ideal time. Make sure you have things in order from a fundamental standpoint and don't skip the weight training. Anything else?
And the protein, and yes, yes. Just
Eat
keep
the
on
protein.
re-listening to this and the fundamentals and foundations for sure. Yeah.
Awesome. Kim, if people have more questions for you, which is likely, what's the best way to get in contact? Where can people, get in touch with you? Socials, website, what's best?
Yeah, definitely. And I've been working my website to kind of get a better clarity on there and just like things and services that I offer and stuff. So still a work in progress that. But people generally email me. So I have my work email now, which is KYM at innatehp.com. You can
Saw that
contact, there's a
change, by the way.
contact. Yeah, there's a contact form, like, on my website now you can people will reach out through there, and then if you're interested in working together, I basically only see clients through a discovery call now first because I wanna make sure that we are ideal for working together, which is definitely a good policy to have. I have an Instagram too, you can follow me on that, and hopefully getting more, like, good educational content out there. That's been one of my goals this new year, and just, getting my monthly newsletter re-going, or what's the word? Like, I was lacking on that for a while, for sure.
Doing all the right things. Awesome, Kim. Well, hey, I appreciate it. This was a ton of info, but super helpful on a topic that I think we're just gonna keep hearing more and more about, and people are gonna keep having questions about.
Yeah,
So I
thanks
appreciate your
again.
time.
Thanks for having me on, Trevor.
Absolutely. All right, guys. Thanks for listening. We will talk with you next time.